from the premiers, well, they are calling for more federal cash as they're discussing privatization of certain delivery of healthcare items after the healthcare summit that was in Victoria just a few months ago. They're saying that there's urgent action needed in terms of from the government. And this is Premier Ford who's leading the way. And they gathered yesterday in Moncton, New Brunswick for the summit on healthcare, calling for a significant change on the delivery of services in their provinces and also, I guess, putting out there that there might be more services that would be provided through private sector. Now, what this means when it comes to the federal government, well, the federal government does transfer payments to the provinces for them to spend on healthcare. But also, when it comes to public healthcare, that is a cornerstone of Canadian healthcare system. So asking for certain changes could possibly mean privatization of some of the healthcare delivery items. And although Premier Ford is saying that the status quo is not working, he's leading the way to, potentially bringing something new about when it comes to Canadian healthcare. Take a look from the message of the premiers.
Talking about multiple areas that we share in common. Healthcare is the number one priority, along with ourselves and all premiers across the province and along with the federal government. We look forward to having a collaborative relationship with the federal government. This is a Team Canada approach that we need to take, as all the premiers here have discussed. When someone walks into an emergency room, be it in Halifax or Moncton, anywhere across this country, all the way up to Victoria and Vancouver and everything in between, they don't want to be sitting there for 10 to 12 hours. The backlog surgeries, they don't want to be waiting forever for a backlog surgery. We're working collaboratively together. We're going to come up with a strong solution that works for everyone in Canada. But again, we can't do it alone. We need the support of the federal government. Had a phenomenal conversation with the Minister LeBlanc today, and he wants to work with us. We all know Minister LeBlanc. He's done a great job in working with all the premiers. But I did mention to him, I can't have a conversation alone. This needs to be with all premiers from all provinces and territories to sit around the table and come up with a solution. Because doing the same over and over again, throwing billions and billions of dollars at a solution and keeping the status quo is just not working. We also need the partners from the healthcare sector. Every single CEO I've talked to from the largest hospitals in this country, talking to doctors, talking to nurses, the status quo is not working, folks. We need to be creative. We need to come up with ideas from the sector, not just us sitting around the table having a conversation, but it's the sector that matters. And we're going to work hand in hand with our CEOs of the hospitals and the doctors.
There you have it. Ontario Premier Ford is leading the way when it comes to doing healthcare a different way. If this works, well, this could potentially go down as part of his legacy of the changes he brings when it comes to Ontario as well as Canada. Now, the premiers have asked previously when they met for the summit in Victoria for healthcare funding to go from 22 to 35%. And they're saying that this is the way that it could be sustainable and to make sure that the healthcare system in Canada is functional. And the federal government saying that the calculations used by the provinces do not accurately account for what is Ottawa's contribution to healthcare transfers. And this went back and forth, if you recall, in the media just a few months ago. But Premier Ford is making a case here when it comes to healthcare and delivery of healthcare, saying that it's important to outline the issue at hand and to make sure that potentially privatization of service delivery. And he does say that you'll still be able to use your OHIP and not your credit card like our neighbors south of the border. Well, this is something to be seen. And of course, we're going to follow through with the story.